Hello, everyone. My name is Brianna Dawson. I'm the campaign/events manager for the not-for-profit organization Elevate Her. Today, I have the pleasure of interviewing Dr. Norvell Coots and his wife, Claudia. Dr. Norvell Coots serves as the president and CEO of Holy Cross Health and the president and CEO of the Maryland region of Trinity Health. He is currently the chairman of the board of Maryland Physicians Care and Medicaid MCO and serves on the executive committee of the Maryland Hospital Association. As a retired veteran, he has used his sternness of knowledge and level of protection to further his education. Dr. Coots is a board-certified dermatology, holds a master's degree in strategy from the Army of War College, and continues to be involved in our community. Born in Colombia, South America, Claudia Coots has a degree in physical therapy. For several years, she had a private practice prior to coming to the United States. She's the mother of 2 teenage children, and aside from being a homemaker, she supports numerous charities. The topic of discussion for today is COVID vaccinations for children. In preparation for this interview, we collected questions from our community, as we value their voices and concerns. Today, you will get to hear from the standpoint of being a medical professional and a parent. Let's get started. Dr. Coots, to help ensure that our audience understands current events associated with the vaccine, can you please describe the current status and shift in COVID-19 mutations and the reduced precautions? What is your opinion on reduced mask mandates?
Yeah, thanks, Brianna. I appreciate that question. So it's a very interesting place that we're in right now where we're trying to decide if we're still in the pandemic or if we're actually in the phase which would be called endemic, where the disease is just prevalent in society and it's just something that we have to get used to, similar to the annual flu that we have. So a few months ago, we changed from the Delta variant to what was called the Omicron variant, and that was the BA.1 variant. That virus has mutated several times in the last 6 months to BA.2, to BA.2.1, which caused an awful lot of infections in the January and February timeframe, now to BA.3 and BA.4 and BA.5. So BA.5 is now poised to be the dominant variant that exists right now. The good thing about all of these is as these variants have continued to mutate, the disease itself has gotten a little bit less severe. But I don't want to send the wrong message by saying that, because it can still cause severe illnesses, and we still do see occasional deaths in patients that we have in the hospital. I think that we probably made the right step in decreasing the mask mandate to a degree. I think we jumped a little fast in removing it completely for indoor gatherings, because we do see large events turn into super spreader events where many people, will go to a wedding party or go to a dinner or something like that, and 20 or 30 people will wind up coming up COVID positive. But for the most part, and particularly now that it's summer, when people are doing more and more things outside, then I think you're safer in taking the mask off. You're extremely safe in taking the mask off if you've been vaccinated and boosted as an adult, and not just with one booster, but with a second booster, which is out and available right now. I think, though, for indoor events, you still have to be a little bit cautious and kind of do a risk assessment when you go. And if it's very crowded on the inside, I always still carry a mask in my pocket and pull it out and put it on if I'm in a crowd that I think is a bit risky.
Thank you. As we have seen in media, FDA's approval and the CDC's recommendation, the vaccine is becoming more available to younger populations. This has caused hesitancy among parents, as we still don't really truly understand the impact of vaccine in developing bodies. Dr. Coots, could you elaborate on the COVID-19 vaccine for kids? Is it really safe for children? What symptoms should parents expect? And is one brand better than the other?
Yeah, so thanks. Again, that's another great question. So there are actually 2 that have been FDA approved for emergency use authorization. One is the Pfizer and the other is the Moderna. And there are a couple of new ones that are still out there in development that haven't yet been approved. So it's approved down to ages 6 months and older. So the last group is 6 months of age to 5 years old. And it has been tested in all of these different age groups, from the young adults to the teenagers to the elementary school age children, and now in the 6 months to five years of age. So it is considered safe and it has been approved. I think the side effects that you would expect to see are pretty much the same side effects that you would see just about with any vaccine. You'll see some redness and irritation at the vaccine site. You may have a little bit of lymph node tenderness under the arm. Some people get a little bit of fever, get a headache, and sometimes a little bit of fatigue that comes along with it. You'll hear people say, wow, I got the shot, my arm hurts, and I'm really feeling tired and just had to lay down and go to sleep. That same thing are some of the signs and symptoms that you see in children who have gotten the vaccine as well.
Thank you. I'm sure our audience of parents really appreciate that. Mrs. Coots, considering the information you just heard, who made the decision to vaccinate your children and why?
We talk about as a family, but at the end, it was my kids who decided to go and get the vaccine because they really wanted to be back to their normal life and be able to be with their friends and play and feel safe.
I think you kind of touched on this question already, but Mrs. Coots, how did the access to school and other activities figure into your decision to vaccinate your children?
It was very important to have them back from streaming at the beginning. So we wanted them to be back to school, and that was the only way to be back with the vaccine. So we wanted them to be safe and be back to normal and be with all the classmates and be able to participate in the sports and classes and other extra classes activities. And that was the only way.
And in addition, Mrs. Coots, can you share with us what the vaccination has done for your children, and do they see it as helping them in their daily lives?
Yes, definitely they felt safe, and they felt safe, and they knew that with the vaccine they will not be exposed to the COVID-19, and that way they knew they would not be sick or being hospitalized or any other symptoms that people were having. They also felt stronger, and they were like with less stress to be around other people and classes and sports and be able to participate in their regular activities.
Thank you for sharing that information with us. Now back to you, Dr. Coots. What is the youngest age that a child must be to get the vaccine, and how are the doses determined for the different age groups of children?
So right now it's approved down to age 6 months. And so the vaccine is dosed basically based on the age of the child and really the weight. And if you think about it, that's how most vaccines are dosed anyway. So whereas an elementary school child might have gotten 30 micrograms in a dose, this age group is going to get about 10 micrograms per dose because they're smaller and weigh less.
And can children get boosted, or is one shot enough for their immune system?
Well, it's not one shot, but it's a complete series. So for the Pfizer vaccine, it's 3 shots. And for Moderna right now, it's 2 shots. Boosters have not yet been approved for children under a certain age. So really it's the older children, the young adults and up who can get the booster. So gradually it's sliding, but I think what will happen is as we go on with this and it becomes more in that endemic phase, that more normalized, we will get a COVID update vaccine every year, just like a flu vaccine. So from that standpoint, I could say, yes, after the initial series, every year you'll get a booster, because right now they're developing boosters that are Omicron specific for this coming year based on the current variants, which is, again, very similar to what we do with the flu.
And this is more of an opinion question, but will vaccines be mandatory in schools? If so, will kids with medical conditions and religious obligations still be allowed to participate in school events without a vaccine? What's your opinion on this?
Yeah, that's an interesting question, because I think we all know that the vaccine got hyper politicized. It became really a political football or a political hot potato. And so there are a lot of vaccines that are mandatory before you go to school. You have to show your shot record. You have to have all of these things. The COVID vaccine should be nothing different than that. But right now, there's so much political pressure around it, people don't want to mandate it. I think the more we get into the endemic phase and the more we give an annual updated shot, I think you will see it being a requirement for schools and participation in sports and other activities like that, just like you have with the tetanus shot and, you know, the polio vaccine and the hepatitis vaccines, all those things that you have to have before you go to school.
Thank you. And Dr. Coots, regarding medical conditions and the understanding of severity of comorbidities, if a parent has a child with something like diabetes, what should they consider before vaccination of their child?
Well, I think that they should think about the fact that if you have an underlying health condition, particularly like diabetes, and you get COVID, you have a worse prognosis, you have a more severe disease. Because one of the things that COVID does, if we're talking specifically about diabetes, is it affects a number of the organs that actually process sugar in the body. And it specifically hits the pancreas and changes the pancreatic islet cells. And so you see sometimes people who don't have diabetes become diabetics after they've had COVID. So if you go into COVID with diabetes, you will have a worse outcome. So I think if you're a parent of a child with diabetes, you would want to get your child vaccinated just to protect them from having any bad outcomes if they got the virus.
Wow, that's really interesting. Which physical or mental conditions should parents make their doctor aware prior to getting their child vaccinated?
So like any vaccine, you tell your doctor if there are any known allergies or if there have been any reactions to any vaccines that the child has taken in the past. Also, it's important to know if there are any food allergies because some of the different vaccines are made with food components. The current two that are available for children right now are not. So that wouldn't be in the category, but I think you still need to make the healthcare provider aware of all and any allergies that the child might have. In terms of mental health conditions, there are special accommodations that can be given to children when they go for the vaccine. For instance, if a child needs a service dog because they have a behavioral health issue, and that dog calms them down, that dog will be allowed in the vaccine center or the facility where they're getting it. So just talk to the doctor, the primary care provider, or the pediatrician for the child will know about those conditions. And, you know, they can even call ahead to the clinic and say, hey, my patient is coming in, they need this or they need that, you know, and just to be a little bit more aware of their specific needs because it's very personalized.
Yes, and there have been a few reports of adults stating that they begin to maybe lose their hair or experience other symptoms after their third booster shot. Is it likely that there could be unexpected reactions to a small group of children? According to the CDC, side effects are more common after the second dose for children. So what should parents really expect?
Yeah, so I'll start backwards. So there are more side effects after the second dose, and that's because that first dose has sort of revved up your immune system. So when the second dose hits, pow, the immune system responds right away. So if you got a little bit of redness at the site after the first one, you might get a little bit more redness. If your arm hurt a little after the first, it might hurt a little bit more. If you got tired, you may really want to go to sleep after that second one. I had those same reactions after my second shot and with each of my boosters too. With each subsequent one, I felt just a little bit more sleepy and a little bit more fatigued. So I think that's sort of normal and par for the course. As to whether or not people can expect to have reactions, there's always going to be a small percentage of the population who are going to have a reaction to the vaccine that is beyond what you'd normally expect to see. Being a dermatologist, I really hadn't heard about the hair falling out issue yet, but I'm sure that probably somebody has seen something like that too, because again, there are a lot of things that happen in the body that we call autoimmune, meaning that they are immune reactions of the body against itself. And sometimes a vaccine can cause an autoimmune reaction to occur. It can be like a trigger. So if there are people who have known autoimmune conditions, that's one thing that they should also tell the doctor before they go for the vaccine as well.
And how could parents report any adverse effects?
Well, sign up to get the vaccine. There's a site called vSafe, V-Safe, S-A-F-E. So you register for that on your cell phone. The health department and the federal government will send you all kinds of text messages. They will check in periodically and ask, how are you doing or how is your child doing? And you can then report any signs and symptoms that the child is having right there on that vSafe site, and they'll load it in and everything. And that actually helps statistically as they look at the vaccine and say, well, with this one, we only saw 61 cases of X, Y, and Z. So it really helps the vaccine developers and the health department who are tracking all of this.
Thank you. And Mrs. Coots, if you didn't have a medical doctor in your home, how would that have changed your information sources and decisions about vaccinating yourself and your children?
Well, I'll first check with my primary care doctor, and I will also go to safe websites like the county website or Montgomery County schools, or the well-known clinics like the Johns Hopkins Clinic or Mayo Clinic and things like that. I will search.
As a parent, what would you say to other parents, and how would you make your decision?
Well, first I will say that the COVID vaccine has been approved by the FDA, and it was done because scientists did several trials before that was approved. I will say that the vaccine is safe, and it's been approved for children that are 6 months and older. The doses that they need are just 3 small doses. It depends on the vaccine. For example, Pfizer only needs three small doses. I'll also say that the vaccine, it doesn't have like bigger risks or complications. It's very mild or very, very low. The children may get a little bit sore by the second doses, but it's very rare and very, very mild. It's also a vaccine that is free. They can get it for free with the doctors or at the pharmacies. And it doesn't have to be like, they don't require what's your immigration status or what's your insurance. They won't ask anything about that. So parents should not be worried about all those questions. And it's for free in every place.
Thank you. Mrs. Coots, do you think there are differences in how mothers, fathers, and grandparents make their health decisions for their children during the COVID-19 pandemic?
Well, statistically, women are the ones that take the decisions when it's concerned about healthcare issues. And it's being proved that mothers are the ones that take their children to take the COVID vaccine. Usually young mothers will check the internet or will talk to friends when they have questions about COVID. And grandparents, they are the ones that will usually call their doctors when they have questions about that.
Lastly, Mrs. Coots, if you could speak to our Latina mothers about their concerns about vaccinating infants and very young children, what would you say? Could you please answer this in Spanish first and then say your answer in English?
Yes. Puedo decir que esta vacuna ha sido aprobada por los científicos y antes de ser aprobada fueron realizadas varias investigaciones y fue aprobada por el Departamento de Drogas y Alimentos. Esta vacuna es segura para niños de 6 meses en adelante. Las dosis que necesitan son dosis pequeñas, solo 3 dosis, de acuerdo al tipo de vacuna que vayan a usar. En este caso, si van a usar la vacuna de Pfizer, son 3 dosis muy pequeñas. Es una vacuna segura que ha sido aprobada por el Estado y es una vacuna también gratis, que no tiene ningún problema para las personas que tengan preocupación por el estatus de inmigración o que no tengan seguro. Es una vacuna que la pueden conseguir en las farmacias o por medio de sus médicos y es una vacuna que no tiene ningún valor económico. Les puedo decir que por favor vacunemos a nuestros hijos para tener unas familias sanas, unos niños saludables y así poder ayudar a nuestra comunidad a mantenerla libre del COVID. I can say that this vaccine is safe, is being approved by the FDA, is free. You can find it in the pharmacies or with your primary care physician. It's something that it doesn't have high risk or symptoms in the kids. And I will just encourage parents to get their kids vaccinated, to have healthy babies, healthy families, and to keep our community safe and with very low rates with the COVID.
Thank you so much, Mrs. Coots, for sharing your thoughts and experiences with us from a parental perspective. Dr. Coots, I will now address my final questions to you. Is the vaccine necessary if the child already had COVID?
Yes. What we're seeing is that once you have COVID, you have about 90 days of native immunity, and then the immunity starts to wane. We know that there are people throughout the pandemic who've gotten COVID 1, 2, 3, 4 times. And even some of those who get vaccinated can also get COVID, but it has a tendency to be a much less severe and a much shorter course. So I would say yes, even if your child has had COVID-19, definitely get the vaccine. And then when boosters are available, particularly this fall, if they come up with a variant-specific vaccine, then go ahead and get that booster as well.
Do children still need to wear their masks or test after getting their vaccine?
Yeah, if there are symptoms that look like the flu, or the child says, oh, I feel a little sick and I have a sore throat and I feel very tired, it doesn't hurt to go ahead and do the test. The tests are free. They're available at the libraries. You can apply to have some sent in the mail. You can order them online. So there's a lot of testing available, and there are still testing sites for the counties as well. And so it doesn't hurt to go ahead and test just to make sure, because I would rather be tested and be sure that there's no COVID, as opposed to saying, well, I thought it was the flu or the virus, or rather like my hay fever or something, and now everybody in the family is sick. So it's best to test. And it's always safe if you're in a crowd, you don't know the vaccine status or the COVID status of the people you're around. It's always safest to have a mask and to go ahead and mask up, particularly if you're indoors. Again, less of a risk if you're outdoors, but still, you kind of have to factor in where you are, what the situation is, and how well you know the people that you're around.
Thank you. Has the vaccine been tested on Black children in clinical trials? This is one question that's really important to our community.
It has been tested. Unfortunately, there are not a lot of Black participants and even Hispanic participants in a lot of clinical trials. There's a lot of distrust about the whole industry. And so it's not as easy to get African Americans and members of the Latinx community to come in and be part of it. But we're starting to see more and more success. The more clinical trials that are being done now, the more African Americans and Hispanics are being recruited and actually being in these vaccine trials.
Well, I want to thank both of you for coming out today to answer some of the questions that's really important to our community. We really appreciate both of your time today. Thank you so much.
No, thank you very
welcome.
much. We've really enjoyed being a part of this. Thank you.
You're welcome.